we start? Good morning or good evening for wherever you're tuning in for today's global health conversation on vaccine confidence. I'm Michelle Berry, Director of the Center for Innovation in Global Health and Senior Associate Dean for Global Health at Stanford. Today, we are joined by Paul Costello, who will be leading our conversation. Paul is a senior communications strategist at Stanford Medicine, a fantastic communicator and interviewer, one of the best. For 15 years, he served as Chief Communications Officer at the Stanford School of Medicine, and he hosts an award-winning podcast that you can sign into called 121 that features interviews with thought leaders in biomedicine and healthcare. We are excited to also have Professor Heidi Larson with us. Heidi is a world-renowned professor of anthropology from the London School of Tropical Medicine and Hygiene, and she's also the director of the Vaccine Confidence Project. Dr. Larson previously headed Global Immunization Communication at UNICEF, chaired Gavi's Advocacy Task Force, and served on the WHO's SAGE Working Group on Vaccine Hesitancy. The Vaccine Confidence Project, which she runs, is a WHO Center of Excellence on addressing vaccine hesitancy. Professor Larson's research focuses on the analysis of social and political factors that can affect the uptake of health interventions and influence policies. Her particular interest is on risk and rumor management from clinical trials to delivery and how to build public trust. She served on the FDA Medical Countermeasure Emergency Communications Expert Working Group and is currently the PI for a global study on acceptance of vaccination during pregnancy. She's also involved with an EU-funded project on the deployment, acceptance, and compliance of an Ebola vaccine trial in Sierra Leone, and a global study on public sentiments and emotions around current and potential measures to contain and treat COVID-19. In today's conversation, Paul and Heidi will discuss her research and investigation into vaccine mistrust and disinformation around the world, as well as her timely debut book called Stuck. I love the name, Heidi. How vaccine rumors start and why they don't go away. With more than 200 COVID-19 vaccines around the world, which are rushing towards rapid deployments, polls show that public trust in vaccine is waning dramatically at a time when their acceptance and public adoption is absolutely essential for recovery. Heidi and Paul will dissect the social vectors at the heart of the vaccine panic, shed light on a path forward, I hope, and learn about the career of an inspiring global health leader, Dr. Heidi Larson. So thank you both so much for joining us. We're thrilled to have you. Paul, I will turn it over to you.
Thank you so much, Dr. Berry, and thank you for joining us, Dr. Larson. You know, I was just thinking when Michelle was talking about the confluence of your book and this moment. When you first started writing the book, it was pre-pandemic, and this moment has this sort of joined together. Could you ever imagine that the book would have come out at the same time of a pandemic?
No, actually, the last chapter on pandemics and publics had a whole paragraph on why we weren't ready for the next big pandemic, and these were the reasons why. So just as the book actually started to move into production, they put the brakes on, and I did a 1,500-word prologue on why this book is relevant. We were more concerned that it got published before it got mixed up in election fever, but we would have never, we meaning myself and the editor, would have never imagined it landed on such relevant ground, unfortunately.
As we speak today, there are 33 million cases of COVID across the globe, and more than 1 million deaths. And here in the United States, 7 million cases, and in the past couple of days, more than 200,000 deaths. And one would think that this moment in time, these numbers and the global disruption that we've seen caused by the virus, that trust in vaccines would skyrocket, that people would really come together and that they would see the value in scientific inquiry in vaccines. But that's not happened. Why not?
Yeah, you're absolutely right in terms of the hope of the public health community, but in fact, it's gone, frankly, more opposite than we could have imagined. It's been well, I think there are a few factors. One is that rumors thrive, and these kind of conspiracies, rumors, uncertainty thrive in situations like a brand new virus that is uncertain, and it's hyper uncertainty now. But add to that that we didn't have any treatments, we don't have a vaccine, that it requires kind of government control measures that are really destabilizing people's lives. So it's a combination of hyper uncertainty, government control, and in many settings that is becoming unacceptable for some publics. And I think what's happening, unfortunately, is that these groups that are anti-mask, anti-lockdown are converging with the anti-vaccine people. And it's not even about the specifics of the vaccine. It's about an underlying distrust. And that's really the crux of it.
You know, you said, and you write in the book, that vaccine revolts are kind of a catharsis, and they're rarely about vaccines. And I think you just alluded to that. So what are they about? What are the key components of these disruptions?
Well, as I kind of in the stories in the book, there are histories, there are community histories, there are individual histories, and people have their emotional memories. They kind of put two and two together when something is when they don't. If they're a marginalized group, they're more questioning of what the government is requiring. If there was a history of an earlier vaccine adverse event, or not even a vaccine event, some other issue that broke trust with authorities, like in France, there was a tainted HIV blood scandal that the public got to know about only later. And that really broke trust. And then there was a hepatitis B vaccination program that got stalled because of suspicions of a link to multiple sclerosis. And you start to accumulate these things, so it wears the trust of communities. And then when something is new, it always, H1N1, we were facing a lot of hesitation about the H1N1 vaccine, because that too, even though it was more familiar, being a flu strain, still, it was just a bit too new for the public.
You raised the word trust, and I want to go and ask you about trust. And you talk about two words in the book quite a bit, and one is trust and the other is empathy, and that they frame this fractious debate about vaccines. So let me tackle trust first. Last week, the New York governor, Andrew Cuomo, announced that his state would review any coronavirus vaccines that are approved by the federal government. And he said in a statement that is quite startling, he said, frankly, I'm not going to trust the federal government's opinion, and I wouldn't recommend the vaccine to New Yorkers based on the federal government's opinion. You're an observer across the pond. You have some ability to watch this afar. When you hear something like that, a governor of the state of New York saying, I can't trust the federal government, what are the implications, not only for the US, what are the implications across the globe?
Well, I think the politicization of the COVID vaccine has been another factor that has seriously undermined some of the public trust. And in the book, I talk about the fact that vaccines, you can't you can't look at vaccines outside of the politics, the culture, the histories that surround them. And vaccines touch every single person on the planet. So if you want to stage a platform to play out all these anxieties and politicization, vaccines are one. But I think, the governor not trusting the federal government, I think what he should add to that is he will trust the science, and not to, because certainly wouldn't, as much as I would respect the governor, he's not the one that should be reviewing the vaccines, as it were. That's what science is for. So it's a challenge. Thankfully, a number of industries came together and said they were not going to bend to federal pressure without safety regulation. But still, what it does is make the public think twice.
Let me ask you about, you mentioned pharmaceutical companies. Let me ask you about, in an effort to be transparent, two pharmaceutical companies, Moderna and Pfizer, both in a race to produce the virus, revealed details about their phase 1 study trials a few weeks ago. And it was a rare move to release that information. And it's usually very secret and not divulged until the end of these trials. I assume that you think that that was a big step, a significant step. What are the long-term ramifications of that? And do you think that we'll see other companies, other pharmaceutical companies, release the same sort of data?
Well, I think they must have had enough confidence about their phase 1 trials that, that was going to help build the trust. I think this is as I was mentioning, kind of a hyper uncertain environment. It was a gesture to build confidence, particularly in the face of, federal, and also Moderna is one of the candidates that the government is heavily, invested in. So, they were seeing this growing distrust of federal government. And I think that was one of their efforts to kind of say, wait a minute, this is our credential, and to try to kind of counter the growing distrust in the federal discourse by, upping their transparency. I don't know if that would become a routine thing. It's one of these things that you want to share enough, but not too much, because these trials with each one, they become more certain, more clear. Yeah.
What did you think of this sharing a few weeks ago on your side of the Atlantic? The Oxford AstraZeneca vaccine trial was temporarily stopped because of an adverse reaction of one of the participants and one of the trial volunteers. And from your perspective, how did that play out? Was it a positive moment? Were there missed opportunities? How do you think that played out on the international stage?
Well, I think that it was good that they paused the trial. What I thought, what didn't get played out well myself, is that all the focus was on saying, this is normal, trials get stopped, this is a precaution. There wasn't any mention of course we care, we'll watch closely and give due diligence and care. There was no empathy for the person who had experienced the adverse events. It was all focused on making sure the public knew this was normal. And you don't want to hear that an adverse event and stopping a trial is just normal. So far we've been okay, but it was, as in my book, I say in this rush to make sure we're defending the vaccine at all costs, we have to remember that, there was somebody who was, had an adverse event, a neurological event that, you need a bit of empathy to say, of course, we'll give full attention to the get the best care and this person is recovering. But overall, I think it seems to have been handled okay. Of course, any adverse event always raises questions, and that will not leave the mind of the public.
You mentioned empathy, and I'm curious that where did the scientific community, and you say in the book that the scientific community really has not been empathetic, that they've been so assured of their position that they've not brought along the public. What are the big mistakes that you see that the scientific community has made when it comes to vaccine production?
Well, I think it's I don't blame just the scientific community, and I think I said in the book there are no single culprits in this tension, in this stuckness. I think that what's happened is we've taken from the scientific community and medical professional community has taken a lot of the public trust for granted. But, there was a huge investment in engagement in working with the public around the first 6 vaccines. And it was almost like, okay, they're taking vaccines like they brush their teeth, and adding more and more and more vaccines without really the same level of engagement as with the beginning. And in the meanwhile, I think there's been an issue with systems. I mean, the pressure on health professionals to, the consultations are getting shorter and shorter. The number of vaccines are getting shorter, and people are asking a lot more questions. And there's no time for those discussions. So it's in part a systems issue, but it's also kind of taking for granted, I think, a social contract that we haven't put enough effort into renewing.
We had this, as you say, a social contract for many decades, that there was a common good. And then you look at vaccines, not only protecting yourself, but to protect your community. And the public generally bought into this, and the risk of societal benefits has now turned into sort of a risk to me. When did that fray? When did that begin to fray? And how did that begin to change on the global stage?
Well, I think that as I mentioned, there's a number of historic events. It depends on where you live. I mean, some of these issues are very highly local, and some of them are more global, but they play out different locally depending on political events, depending on, we're living in an environment of polarization. There's a lot of background noise. I don't know.
Can everyone mute their phones, please? We're hearing a lot of background noise, so if everybody could mute, I appreciate it.
I'll keep trying here. I think it's been a convergence of the increased pressure on the system, more and more vaccines, political polarization, other events, but also the whole digital communications landscape has a whole other factor that has had a tremendous amplification effect on what were pre-existing concerns, but somehow have been used and abused to amplify some of these anxieties.
The vaccine project that you had, it just released a new study, and I think it was of 18 countries about the coronavirus. And it found that 41% strongly agree it would take a vaccine. And the variances across the globe as far as trust and confidence were pretty dramatic and pretty variable. For instance, 87% of those surveyed in Uganda strongly agreed that vaccines are safe. And then on the other hand, you have 17% in Japan, 19% in Lithuania say they agree vaccines are safe versus 66% in Finland. What are some of the factors that account for that disparity and that volatility?
Well, I think it also speaks to how local these issues are, how much are embedded in local and political histories, culture, whether or not there was an event. Sometimes it can take one bad apple, as they say. I know in Japan, I've been working closely with the ministry for a long time in trying to get over the anxieties around the HPV vaccine. And they have suspended their proactive recommendation of the HPV vaccine almost 8 years ago now. And that's a long time. And that kind of has created it goes into other areas, that the distrust wears and bleeds into other vaccines. We've seen similar things in the Philippines. The risks around the dengue vaccine led to people hesitating about measles vaccine and even not taking deworming medicines in the schools because they just lost their trust in the system. So it really depends on the situation. Uganda did very well, but they've also had very proactive community engagement and working with the public in a different way. So yeah, it's really a mix. I think you're muted.
What did the global health community learn from Ebola? What were the lessons that they've taken from Ebola, and what did they listen to, and how did they change from the crisis in West Africa?
Oh, well, that's, I think we've learned a lot in Ebola. I mean, I happen to be working with the trust building and rumor management around the trials, Ebola trials in Sierra Leone, DRC, Rwanda, and Uganda. And I think what we saw is that, one, we used every opportunity when some of the clinical trial procedures were slowed or delayed, using every moment to engage the community, to talk with them, to set up kind of community listening networks, and then the participants, as they were enrolled in the trials, creating kind of support groups with them, making a proactive effort to listen for any emerging concerns early. And I think that kind of, and getting back to the clinic on a weekly basis, not going off and doing a study for 2 years and, it's coming back later. I mean, real time feedback. And when people feel like they're listened to and consulted, it makes a huge difference. I mean, there are a lot of assumptions, for instance, by the scientific community that, oh, you couldn't do randomization in the context of an outbreak. That would be unethical, and it would never be acceptable. Well, in the communities we worked in, we sat down and talked with the community, the chief, the local leaders, and said, what do you think? And they were fine with randomization as long as they participated in it, as long as they were engaged in deciding what was the process. And if the local leader was the one who was picking the names out of the bucket of all the villagers, that was okay. But somehow, as long as they participated in it. So the assumptions sometimes we make as a scientific community are very different from what sometimes they can be the opposite. We assume that everybody's going to trust it, and they don't. On the other hand, sometimes we assume that something wouldn't ever be acceptable, but actually it'd be fine if you just talked to the local community and worked on the solution together.
What you're really talking about is not a top-down. You're talking about going in and working at the grassroots and going up instead of coming down. Listening to
yeah, exactly.
What is the ghost? You've written about Andrew Wakefield in the book. What is the ghost of how is the ghost of, and it may not even be a ghost, how is Andrew Wakefield still playing the false notion that vaccines caused autism in children. How does that continue to play out? And was there or is there any silver lining in that destructive path?
Well, I mean, I think if there's a silver lining, one of them is that it has pushed more investment into research around autism, which because in the effort by the scientific community to disprove the link between a vaccine and autism, which at this point there's an abundance of research that's contributed to the research around autism. So there are better ways to get to that funding than that, but that was one. But also, I think if we listen, if we see what happened with the Wakefield story, and he is far from a ghost. In fact, he has emboldened and has a growing following, because he says, as I was talking about with the Ebola story, he says, parents know best. How do you feel? I want to, your feelings matter, your concerns matter. And I think that, and the more he got rejected by the scientific community, the more he was accepted and kind of martyrized by a lot of the public who say, or the ones in the public who follow him say, he was rejected. We really stand by him for speaking against the scientific community, and he was kicked out. And so he became one of them, not accepted for his alternative views. So it's become a kind of phenomena. I mean, in the UK, it took 15 years to recover the MMR vaccination rates. They're wobbly, but they're pretty much back, although UK did lose their measles elimination status last year. But I think the engagement part, being responsive to publics, we see the same thing in the social media space. Why are some of the anti and alternative sentiments recruiting, as they say, at a much faster rate than the pro groups? Well, if there's 100 of them, they'll splinter into 10 groups, listening to 10 different concerns and caring about them. Whereas the pro groups, much more homogenized message, sticking tightly together, kind of grand central control, and not having a diversity of kind of outreach and messages for the multiplicity of people's anxieties. Paul, I think you're muted
again.
You write about social media a lot in the book and technology, and I'm curious if the danger is the most significant danger. Is it the spread of rumors through technology, social media, or is it that it has conjoined and brought together disparate groups and it's formed sort of a voice, a singular voice in the anti-vax community?
Actually, it's interesting. It's actually allowed for a multiplicity of voices, but all trying to disrupt and disturb and create doubts and questioning. But they're doing it, interestingly, rather than creating a unified voice, they have created like multiple choirs, multiple songs depending on your taste. I mean, it's kind of the iPhone thing, we'll personalize our messages to suit your interests. And they're being brilliant at it. And I mean, brilliant strategically, and reaching out. And the social media environment has allowed that. So it's kind of ironic that it's created a lot more, but a lot of smaller. Compare the kind of Silicon Valley startups versus IBM. I mean, there you've got the pro and the questioners. just as
The,
an
the
image.
how does the global vaccine enterprise reboot? You've talked about that there needs to be a rebooting of the enterprise, of those who support vaccines. How do they do that? What's the roadmap?
Well, I think it needs to be. I think we need to at a very a local level. Somehow we need to work in more conversation. There's an absolute dearth of conversations. I sat next to somebody at a lunch where was seated next to somebody who I learned was not into vaccines, and her colleague with her, her friend also was not pro-vaccine. But at the end of the lunch, and she asked me a lot of questions. At the end of the lunch, she said, you know what? I'm going to give it a go with vaccines. And you know why? Because you made a vaccine not anonymous. The biggest thing I've been feeling is that they're anonymous. I'm not talking to anyone. Nobody is. And it really stuck with me that, I mean, it was only one person, but she kind of captured the anonymity of it all. So we have to really, in any way we can, and I know doctors and nurses don't have much time, but maybe we need to get people in waiting rooms, do more with chatbots, figuring out ways that there can be more engagement and better listening.
When you hear something like, there was a report in the New York Times on Saturday that tens of thousands of Chinese, perhaps even hundreds of thousands, have been given 3 vaccine candidates that are outside the traditional testing process. And no other country has really taken this unusual step and risky step to inject people with still unproven vaccines. How do you think that plays out? How do you think that sort of, and are you concerned about something like that at the potential substantial negative consequences of that and the impact that will have upon the globe?
Well, it's high risk behavior for sure. I mean, they rationalize it by calling it emergency use. Um, and I think the concerning part too is that they've given, government workers in a number of settings the vaccine. And I think one of the big other concerns is the consent process. I mean, was this take this or lose your job, or you're not being loyal. I think the consent process is concerning. The fact that they are giving it to what seems to be a lot of people. I mean, I know that's one of the issues with wanting to do mass vaccination is that it's inevitable that when you give just by experience, there'll be somebody who has a small or different adverse event or coincidental. So it will, I mean, hopefully, maybe it'll be good. Maybe they'll be more protected. Maybe they know more than we do, and actually we're farther along. But there's always a risk that in these kind of settings, it does break trust, and the rest of the world says, well, you see, they had their adverse events. We'll see, but I think that the process was concerning. Emergency use is not off the charts. I mean, it has happened in other, even with some Ebola vaccines. I think that is less concerning than the way it's happened in the process.
As Michelle said, the title of the book is great, Stuck. And I love the story of how it came about. I think that it's, as you say, you were stuck in traffic in New Delhi and you saw a sign. How did that unfold? You had another name in the beginning. Yeah. You had another name for the book before Stuck. And how did it come about?
Well, my working title for most of the time of writing the book until about 8, 9 months before, when it was starting to become, a near final manuscript, it was Missing the Point was the working title. And because I felt like so much of the focus in the number of vaccine crises, as it were, that I was going to investigate and try to recover in different countries when I was working with UNICEF, um, it was always about other things. I mean, mostly. Sometimes there was a very specific vaccine risk that needed attention, but a lot of times it was rumors, or it was other reasons, or distrusting, or people, made assumptions that they weren't being taken seriously. But at any rate, the editor, as we got closer to going into production, said, listen, we need something. Missing the Point could be anything. Let's get something more specific. And we came up with a number of different ones. Stuck was one of them, partly because it plays with stuck with a needle and stuck in the conversation. And I really liked that one. And I happened to be on my way to India for some other meetings with the ministries there, and was stuck in traffic. And at one point I looked out the window, as I start with in the book, and feeling it was hot and it was smoky, and there was this kind of bent sign that said, "You are not stuck in traffic, you are traffic." And I thought that really said it all. Here we are the makers of our own stuckness, as it were. And then I thought, maybe there's a helicopter above looking at the pattern of the cars and counting the cars, and they're the traffic engineers. But then I was sitting in this taxi. I had no choice. There was nothing I could do. You really feel this sense of powerlessness. And even opening the windows in the heat there was not really a comforting thought. And it really gave me this feeling of, what are some of the parents? This is the way some of these parents are feeling. Stuck has to be the name of this book.
How do we get unstuck? What are some of the things, if you could change the world around this stuck, what would you do? What are some of the major points of being unstuck?
Well, as I was saying, I think some more engagement and conversation, but at multiple levels. But I also think that we're also caught, aside from the political polarization, which is kind of exacerbating the problem, but we're also in the midst of a dramatic technology revolution. Dramatic. I mean, it is way beyond an information revolution. It has people are organizing differently because of it. They're using it in all kinds of ways. It's affecting work. It's affecting the global economy. It's happening at multiple levels. And I think there is, with that, we have a generation of policymakers, leaders, health authorities, elder scientists, and doctors who are less comfortable with some of the capacities of the social media, and the emerging generation of parents know nothing but living on social media and interacting. And I think that, and there's been this anxiety to go into the social media space, to engage with publics, because it's messy, it's emotional. I mean, I think the farthest I've seen most health authorities go is to send text message reminders about your appointment, which is helpful, but there's no engagement there. Whereas one of the best efforts I've seen in that engagement process was in Denmark, where they had a similar episode to Japan in terms of HPV anxieties. But what they did was they brought in a group of young girls of vaccinating age and co-created a social media campaign to reach the girls' peers. And it just totally turned the situation around. So I think as we get more engagement like that, and also a younger generation of scientists and medical and eventual authorities that are more at ease with this medium, the language will be, I mean, that's not the only solution, but I do think some of that should help. We also have a generation of kids who are growing up and saying, whoa, wait a minute, my mother didn't vaccinate me. I know better. I'm going to get my vaccine. And so there's a generational, rejection of the parents' decisions that they were deprived of their vaccine. So that's my hope. But we can't wait for that transition right now. We've got a COVID vaccine in the pipeline.
Well, that leads to a great final question, because you write in the book, you end the book by saying, I'm a patient optimist. How does that play out for you?
Well, it's a bit of what I was saying. I mean, I think one of the challenges is that there's been a disproportionate investment into new vaccines, more technologies, and it's a pennies investment into engagement and communications and outreach and all that where any proper business would be investing far more into market research, into engagement, into communications, and it's been shocking, actually, how hard it is to kind of generate to get investment in really serious communication, and we need like a behavioral economics approach. There's a huge gap there that really needs investment.
Dr. Larson, thank you.
Thanks.
We're now going to go to questions. And one of the questions that someone said, very interesting, the anti-vax movement is much bigger in the United States than in other countries, such as Brazil, where this person is coming in from. Why do you think that is? What's unique?
Well, I wouldn't rest on my laurels in Brazil, because it has some eroding at the edges there, but and also, we've been monitoring. We established a global vaccine confidence index in 2015, and we've been monitoring public confidence at multiple levels. We just published a big paper in the Lancet, actually in this week's Lancet, 285,000 respondents around the world, 149 countries. Europe has persistently, for the last 5 years that we've been measuring it, been the most skeptical region in the world, more than the US. Although I think if you disaggregate the data in the US to state level, you'd probably see a similar picture to Europe. On the other hand, even though the overall skepticism in Europe is among the worst in the world, there are deep pockets of dissent in different countries and different places, particularly a huge drop in confidence, for instance, in Azerbaijan, Afghanistan, Pakistan, Nigeria, where you have geopolitical tensions or whatever. You see that publics are not trusting the dominating government, and that's who's distributing vaccines, if they are in fact have a functional health system. So what we do see, though, in our tracking the transnational spread of these sentiments, that the US is absolutely the fountain, the source of a lot of the most serious anti-vaccination efforts. It's really replicated into other countries.
Leslie asked the question, how am I supposed to have COVID vaccine confidence when they're not testing on my demographic, a 60-year-old female? How does one have confidence in vaccines when you don't see that you're part of the trial, perhaps?
I would think that's a concern, but I would be surprised if there are no 60-year-olds in any of the trials. I know there are no children right now, but that's normal. You don't start with infants and children, but I understand her point, aside from whether it's 60 or 70 or 80. But I think, you need to weigh the risks and the benefits. I mean, that's kind of sounds very dry, but I mean, my husband had extremely serious COVID, and when you've seen what that can do to ravage a system, and 6 months later, still knock-on effect, and we're learning every day about the systemic damage that COVID can cause, and you're offered a vaccine that has had a lot of safety, and maybe, not exactly my demographic, but you have to make a choice, and it is a risk. Taking a vaccine has a risk. Taking any medicine has a risk. Not to dismiss the point, I think it's an important one, but particularly in this time, in this crisis, people are going to need to make the choice.
Leah asks, what role should institutions like Stanford and other institutions across the globe play in supporting pro-vaccine advocacy? How do you see, what's the role of institutions like Stanford and others?
Well, I think Stanford and others, I think we need more listening, more understanding, research with publics that but then not academic research in itself. To work it into, Stanford has a fantastic health, you've got your hospital, you've got your health services, you've got medical professionals. I think bring some more into the medical school curriculum, into the health training about, personalizing. Also the whole challenge for in medical training, you're trained maybe to give difficult diagnoses like a cancer or HIV or things that now HIV is more treatable, but the certain disease situations, you're not trained to deal with a very difficult consultation where people are challenging you on what they're recommending. Maybe we do more role playing with in medical training or in health professionals. I think it's on different sides, any place along the system where we can get more engagement and and change the comfort level. And we need to start to get willing to try to get back a conversation when you don't necessarily agree. That's been tough at multiple levels.
Gabriella sort of has a question to follow up on that conversation, and she asks, this investment in conversation that she calls marketing and understanding the vaccine market, who should play that role? Where should that investment come from? From pharma, from government? How do you forge that together? How do you make that powerful? Whose role is that? Everyone's role?
Well, I think it's everyone's role, but I think also, public sector, government and pharma are two that have vested interests in the vaccine being accepted. But there are, public sector foundations, private donors. It could be other businesses too. I've been asked to give a talk next week to the aviation industry. They are, their business around the world will only revive in the immediate future with a vaccine. Religious leaders are, Hajj was canceled this year. There are certain countries you can't. There, the meat packing industry, the food industry, education. I mean, other industries in the private sector whose functioning will depend on a vaccine would be important one. Engaging employers, for instance.
What are you going to tell the aviation industry? What's your message going to be to them?
Well, I think that the first one is for their own employees. I mean, they want to know what the hope is around vaccines, but also for their own staff. So I think one of the starting points is to engage their own staff and understand their own staff's concerns, because that's the frontline workers. And if they want to protect their own staff, that's the first thing. And then, of course, that will affect their passengers and the morale. So we'll talk to them about that, but also, hearing how, I think engaging their employees and how are they doing? I think also the other thing that we've missed out in the shortness of the time, it's, let's use that time to say, how are you? This is tough times, not just about, do you want to take this vaccine, but, how's the family? How are you doing personally? How, are there other things you need? Yeah. I think we unmuted.
You muted.
Mute? Oh, yeah. Great. Thanks.
I'm looking at questions. Do you think the most effective way to regain vaccine confidence is to act the same way anti-vaccine folk do, to get more supporters, talking directly to people, understanding their individual situations, other than big government actions? So is it one-to-one? Is it, what's, instead of the big government actions, what's the way to engage?
Well, I think the government has a certain responsibility. It's not that it should be one or the other. And I think we need to be doing it at multiple levels. So, I think that that's it. We've been too unilateral and not diversifying enough. I worked for years in AIDS, and in the AIDS movement, we were engaging all kinds of people of different walks of life. The vaccine health as a health area hasn't really engaged much outside of the health sector. And I think we need to change that modus operandi, as it were, and use different ways to engage. So I would say, to the extent that the anti-vax folk have been hugely diverse in their outreach, that I think is something to pay attention to.
Someone had a question about the polio vaccine and what happened in the US with the polio vaccine, and what did we learn from the polio vaccine immunizations that is transferable to today?
Well, in the global eradication initiative, which is the one, when you eradicate, you really have to, not get every last person polio free. We've had to deal with the hard part, the last mile, as it were. And I think some of the same things we learned from polio are hugely relevant for the communities that were distrusting who was delivering the vaccine, or either central government or the Western powers that were, in their eyes, controlling this eradication effort for they didn't trust the motives. What started to build trust in some of those settings was offering other health services. Some of them said, why should I take your, pointing to the government, polio vaccine when you don't even give me water? You don't really care about me. You've got some other motive. So I think embedding the polio vaccine in a with other things that sort of gave a gesture of, we care about you beyond this vaccine, was really helpful in a number of settings.
Someone is asking, what is the financial cost of the failure of ratifications? You've seen and you write in the book that there have been some significant costs associated with that. What are those? What are the financial implications?
Well, I mean, one of the things that actually motivated me to write this book and start my basically found my research group, because I saw it being so profound, in 2003, 2004, when Kano State in northern Nigeria boycotted the polio vaccination because, one, they didn't trust central government after losing a presidential election. The northern candidate lost to the south, but then also it was post 9/11. They didn't at all trust the West's high investment in this polio eradication campaign. They felt like there had to be something suspicious there in this war on Muslims. That these rumors started, they created this boycott. There was no adverse event. There was nothing specific. It was just the anxiety, the distrust of motives. That 11-month boycott not only led to the spread of polio across Nigeria, but across 20 countries as far as Indonesia with the Nigerian strain, via Mecca, which also contributed to how it got to Indonesia. And it cost the polio program $500 million to recover the progress lost, all because of a rumor, just a rumor.
Dr. Larson, thank you for joining us today for a great conversation.
Thanks so much.
Thank you, Paul and Heidi, very much. And it was an incredibly provocative conversation. And I just wanted to say that for those of you who are interested in the next Stanford Global Health activity, we are running the Women Lift Health Conference, where Dr. Larson will also be participating, October 13th through 15th. It's free registration. Thousands of women and men will be attending to discuss some of the barriers of women leadership in global health. So thank you again, Paul and Heidi, and a really great conversation. Thanks. As usual, Paul, thank you.
Okay. Cheers.
Cheers.
Thank you.
Bye.